Hi guys, let's talk about the wall anatomy of the gut. Very important to understand the pathophysiology, right? Now, the innermost layer that you will see in the entire GIT anywhere is going to be the mucosa. Surrounding mucosa, you have the submucosa. Surrounding submucosa, you have the inner circular muscles. Surrounding the inner circular muscles, you have the outer longitudinal muscles. Now, beyond the outer longitudinal muscles, you have a layer which is going to vary a bit. We'll talk about it in a bit, right? Now, as I told you, the innermost layer is going to be the mucosa. So, this depicts the mucosa. Now, what is interesting about mucosa is the epithelial component of the gut. That means anywhere starting from esophagus all the way to anal canal, the mucosal component will consist of the epithelial surface. So, the epithelium is present in the mucosa. Surrounding mucosa, you have the submucosa, right? So, under the mucosa, you have the submucosa. Then you have the inner circular muscles. We have the inner circular muscles which are here, which is depicted. Then you have the outer longitudinal muscles. You have the outer longitudinal muscles. Now, the last layer that you can see here, it depends that which content or where are you talking about. Now, if you're talking about in the thorax, that is above the diaphragm or below the level of pelvic diaphragm, you do not have peritoneum, and when you don't have peritoneum, you will not have serosa. Why? Serosa is a fancy name of visceral peritoneum. So, if I say the serosa is present, now serosa is nothing but a fancier name of your visceral peritoneum. It's a fancy name of a visceral peritoneum. Now, why it is important is the peritoneum is only present in the abdomen. So, if the organ is not intra-abdominal, it will not have serosa. Best example, esophagus, it's in the thorax. So, hence it will not have serosa. Serosa is absent. Same way, the lower two-thirds of the rectum and the anal canal will also not have serosa because they are not in the abdomen. So, what is serosa? It is a fancy name to tell you that it is a visceral peritoneum. Now, what is interesting to notice in all these components is you will see that the neuronal plexus which are present are divided into two categories. As we all know, Meissner's and the myenteric plexus. The Meissner's plexus are present in the submucosa. The myenteric plexus are present between the junction of the inner circular and the outer longitudinal muscles. Now, why it is interesting is because of their function. Now, the one that is present in the submucosa, these are what we call it as the Meissner's plexus. These are what we call as Meissner's plexus. Now, because they are present in submucosa, their basic function is to cater absorption and secretion. So, they are responsible for absorption and secretion in the gut, whereas your outer ones, these are your myenteric plexus. Now, the alternate name for the myenteric plexus, it is also called as the Auerbach's plexus, right? Now, if you ever have a doubt which one is in submucosa and which is present in the longitudinal and the circular muscles, myenteric, my means muscle, enteric means bowel. It is present in the muscular component of the bowel. Now, because they control muscles, they control what? They are going to control peristalsis. So, peristalsis is because of myenteric plexus. Now, on the outer component, you have these specialized cells. Now, these specialized cells which are present on the outer half, these are what we call it as the interstitial. These are the interstitial cells of Cajal. Now, this interstitial cells of Cajal are also known as the pacemaker of GIT. They are also referred to as the pacemaker of GIT. Now, a very important point. What? If a tumor arises from the interstitial cells of Cajal, what do you call it as? You call it as GIST. GIST is your gastrointestinal stromal tumor. Most common site is going to be stomach. Another interesting point that you will see that the vascular pool in the gut resides in the submucosa. From here, it will give the blood supply to the every nook and corner of the bowel wall. So, the vascular rich component or the one that provides the maximum vascularity is going to be submucosa. That is why whenever there is a mucosal breach, there will be bleed, but significant bleed occurs when there is submucosal breach, and that's the concept that you need to remember, right? So, all this in a nutshell is the basic anatomical orientation of the gut wall. Thank you.